Okay, this video is Hypertension Part 3 from the book John Mcdougall, The Doctor Who Fought for You by me, Pete Rogers. We're talking now about pharmaceuticals in the treatment of hypertension. We just finished up talking about overtreatment of blood pressure and how that could cause you to die sooner from the Dr. Mcdougall newsletter, July 2004. We're now talking about the February 2007 newsletter of Dr. Mcdougall from Dr. Mcdougall's website, which is drmcdougall.com. And this one's called Disease Mongering, New Women's Guidelines for Heart Disease. And now these are what Dr. Mcdougall says. He says, blood pressure medicines are poisons. They disrupt normal body functions through chemical reactions. Poison is the correct word to describe these drugs. Beta blockers poison the heart muscle. People on beta blockers often complain that they can't walk upstairs because their muscles are so weak. ACE inhibitors are poisons of the adrenal glands to prevent the production of angiotensin II. Angiotensin receptor blockers, ARBs, they block angiotensin II. Doctors often confuse ACE inhibitors and ARBs. Doctors often think they are the same thing, but they are not. ARBs might increase the risk of myocardial infarction, a heart attack. Reference is the Journal of Circulation 2006. ARBs have names that end in sartan, like losartan, valsartan, etc. Dr. Mcdougall says, I never prescribe ARBs. Okay, next medicine in the treatment of hypertension is calcium channel blockers. Calcium channel blockers are poisons. They poison the blood vessel so that the blood vessel will relax. These poisons artificially reduce the perfusion pressure to the heart and the brain, and they might increase your risk of dying if you overtreat with them. Dr. Mcdougall says, I do not prescribe calcium channel blockers for hypertension because when calcium channel blockers are added to a diuretic or used alone, there is an increased risk of heart attack by about 60%. That doesn't make sense to try to prevent heart attacks by giving a medicine that increases the risk of heart attacks. References from JAMA 1995. And this is about the risk of hypertension associated with some antihypertensive drug therapies like calcium channel blockers. Calcium channel blockers also cause constipation, and he says that they increase the risk of suicide. Great. And here's a reference of this reference also says calcium channel blockers might increase the risk of overall cancer and especially breast cancer. Great. What a great treatment option. It'll increase your risk of heart attack, constipation, suicide, and cancer. Wow. That sounds like a really good therapeutic there. Okay, Dr. Mcdougall continues. Calcium channel blockade and the incidence of cancer in aged populations from the Lancet Journal 1996. Then he says there is no reason to use calcium channel blockers for the treatment of hypertension. Calcium channel blockers, and the names include diltiazem, amlodipine, nifedipine, and he says, I never prescribe calcium channel blockers for hypertension. So let's get to the main point. Dr. Mcdougall, sick people take medications, healthy people don't. When a person stops eating high-fat diets, their blood pressure drops rapidly. That makes the biggest, fastest change in blood pressure. So they'll need to have their medications reduced or stopped. They are at risk to drop their blood pressure too low, and they can be at risk for hypotension, could become dizzy, could fall down, hurt themselves, or get into a car crash. So they got to titrate it gradually, work with their healthcare provider to do that. It's safer to have a high blood pressure than to have too low of a blood pressure. Because, what's the purpose of blood pressure? To get blood to the top of your brain, your cerebral cortex, pumping against gravity. It's the hardest spot to pump to. It's easy to teach a doctor how to lower these blood pressure medications when a patient goes low-fat vegan. They should check their blood pressure in the morning because that's when it's going to be highest. Sick people take medications. Healthy people do not take medications. I don't take any medicines. I'm 60, okay? Low-fat vegans, they're healthy. The healthcare system doesn't make money off them, doesn't like them, okay? The healthcare system loves paleo, keto, carnivore diet eaters. It loves standard American diet eaters. They're great customers. They're always fat and sick. Let's see here. Sick people have surgical scars on their abdomen and chest. Sick people have regular doctor visits. You want to get out of the medical business. These are the words of Dr. Mcdougall. The only way to get out of the medical business is to stop being sick. The only way to stop being sick is to regain your health, to fix the problem. The problem is the food. And like he said earlier, the START solution is the solution to your health problems. Like I said, Dr. Mcdougall said, if you don't know what to do and you're just starting out, try to get yourself eating 90% of your calories from a starch and then add 5% each from fruits and vegetables. You do that, you'll make great progress. And in the meantime, you can start reading and learning about everything else. And then he says the lowering of sodium in the DASH diet trial in 1997 did not lower blood pressure that much. For example, lowering sodium intake from 3,000 milligrams per day down to 1,500 milligrams per day didn't make that big of a difference. What Dr. Kempner would say is you got to go lower than that. Try getting it down to 500 milligrams per day or lower, because there's a threshold effect. It doesn't kick in until you start getting down lower. Okay. So anyways, that's it for this. This was Hypertension Part 3, talking about the meds. And the bottom line is the only med he likes to use, if he even has to, most of the time he doesn't use any medicines for treatment of hypertension. If they're not sustained like over 150 over 90 for months at home, then he won't even treat it with meds. Keep on working on the diet. And if he does give a med, the first medicine he gives, and usually the only one, is chlorothalidone, the diuretic. Okay, I hope that was helpful. That was Hypertension Part 3.